In this video, I really want to go through the process of egg freezing, what that actually means, how long it takes, what it involves, what you should be mindful of if it's something that you're considering, and the cost. So let's start with the cost because it's one of the biggest factors that might limit somebody from going ahead with this process. As I've mentioned in my first video, that this was all a self-funded process. And all in all, I would say this has cost me around £5,000, English pounds. And that is a lot of money. And I believe it differs. It differs from different clinics because I was previously quoted around £6,000 per cycle. As I've mentioned before, it heavily depends on your situation because if it's a personal decision you're making just purely for yourself, like I did, then it's a self-funded decision and you won't get support through, insurances or NHS. So I'm just going to talk about my personal opinion, but if you have struggled with conceiving and you have other complications, I do believe there's support through the NHS. So for my particular situation, egg freezing, as I said, cost me £5,000. I've joked in the past that my future husband's going to refund me for all of this anyway, so it's all fine. So £5,000, and that included all of the medication, all of the scans, blood tests, the retrieval itself, the hospital stay, everything. So all in all, £5,000, just slightly over, I think, but yeah, no more than that. With the cost out the way, we can touch on timing. Now, timing again is very dependent on your own treatment plan that the consultant will discuss with you, which is based essentially on your results. So, depending on your ovarian reserve, as I've discussed it before, mine was very normal, very healthy egg reserve. And also, there might be other medical conditions that might be factored in. So, just bear in mind, it's not always just going to be the same case for everyone. But I was put on the short protocol. And I would say from my first consultation to egg retrieval, that took all in all around just over 2 months. But if you factor in just the egg freezing process, I believe that was done in around 6 to 7 weeks. So just less than 2 months, around 2 period cycles essentially. So depending on how long your monthly premenstrual cycle is, menstrual cycle is, you'd factor in about 2 of those. So the initial consultation happens, you agree a treatment plan, you say you want to go ahead, and you'll either get put on the long or the short, and I got put on the short protocol. I don't actually know too much about the long protocol, but that essentially is just based on how much dosage they want to give you to stimulate your ovaries. And essentially, once you agree and you've signed everything, you've given consent, you've paid, the medication is ordered. Prior to that, they will also ensure that you've had the follicle scan that I talked about in my first video, AMH, just to understand your egg reserve. They'll do blood testing for things like making sure that you're healthy in terms of any sexual diseases and HIV, that kind of thing. Look at your history for smear tests. So just make sure you're all up to date with all of this. But if not, they will support you in that. So that could increase the timeline. But I had everything always on top of these things. So he had lots of data to start with, and it was just a really good starting point. You'll get a lot of information during the consultation. So I just want to hide the location of mine, but you'll get things like an egg freezing a booklet, information about what the short cycle means in terms of like an IVF, because it's similar to IVF, but you're just not freezing embryos and then implanting them. So it's just that initial stage of IVF. So it's very similar. So once you've signed your consent, you're going ahead with it. They'll then ask you to call the clinic on the first full flow of your next period. So when you stop bleeding fully, like full flow they call it, and they stress that a lot. So on your first full flow day, you would call in and they will essentially book you in for a follicle scan between, I think it's like 2 or 6 days. So within that week of your period, you'll get a scan booked in. And then they'll know how many follicles they've got to work with. Just again, it's like a baseline scan to assess, how many follicles you've got, and in terms of stimulation, what kind of medication dosage they're going to give you. and also just a way to monitor those follicles throughout the process, because essentially what you're looking for is to maximize as many mature eggs as possible for freezing. So the more follicles you've got, the better. But just because you've got a certain amount of follicles doesn't necessarily mean they're going to give you mature eggs, and they don't necessarily mean they're going to grow into eggs. So just things to be mindful about. So once you've done the baseline scan, they kind of understand how many follicles you've got to work with, they calculate your medication, and they order that medication. And again, that's all part of the cost. You may find that some injections are to be stored in the refrigerator, so constantly being kept cool, and then there's some that are more room temperature. The part that I was the most anxious about was the medication, the injections. I can't even put eye drops in my eyes, let alone injecting myself. But I'm not really afraid of needles. Like, I've never had an issue with being administered any injections. For me, it was just, I've never been on long-term birth control, and then going from that to suddenly injecting myself, it was more around that and what the impact on my body could be, and the side effects. And they do talk about side effects. I think one of the main side effects is something to do with overstimulation and overstimulating your ovaries, and just the usual medical risks associated with, a procedure, a medical procedure. So just make sure, if you do go down that route, you fully understand what those are. Nausea, sickness, going under general anesthesia, just the normal risks associated with surgery. But I weighed all of that up, and for me, I wanted to proceed. So once you've called in on day one of your period, you've had your baseline scan, they've ordered your medication. The next period you call again, and that's essentially when you are ready to then actually start the medication and then effectively the retrieval. And I would say that process literally is finished within 20 days, I would say. So once you've done your initial scan, you would wait for your next period. There's not really much to do in that time. So from, a work perspective or a life perspective, life continues as normal. It's your next period that is the most crucial one. And so you would call again on your first day of your full flow. They'll give you another scan, and this time this is the follicles you're going to be working with for that egg retrieval cycle. And at that point, again, I can show some imagery whilst I'm talking in terms of what that scan looks like, because essentially it is a probe that goes into your private area, and there's an internal scan done of your ovaries, and they count the follicles on the screen. And again, I have showed that on my previous TikToks, what that involves, and how they count it and they measure those follicles, because to retrieve follicles, they need to grow at they need to be a certain dimension. So you may have more eggs to take, but they may not be able to retrieve those. So they all have to grow at the right level, not grow too much and die off. So it's very much a balance that is constantly monitored. So you're constantly going in, to monitor those follicles throughout before they ask you to administer your final trigger shot before egg retrieval. So once you've done that initial AFC scan, you essentially receive, and I need to cover some of my medication, a plan. I'm just going to put this on the screen, actually, it might be easier. So you'll receive a plan, a medical plan that looks like this, and is a treatment cycle, and it will tell you exactly when you need to be taking your medications. And essentially, I actually, funnily enough, didn't have any difficulties or complications, touch wood. Everything, I didn't feel sick, I didn't feel ill. I was bracing myself for the worst, but I just continued my life as normal. I would say when it got towards the end, at the point where you essentially have a couple of scans done before it's time for your retrieval, a scan just to see how many follicles you've got, whether they need to adjust the dosage to see how much the stimulation has been working. Then you'll have another scan just before your retrieval, and it's all on your plan, so you don't lose sight of when all these appointments need to be made. But it is something you need to own. You're not going to have a nurse reaching out to you, so just having to be really organized. So just before your egg retrieval, you will essentially have two scans. One is just to monitor how the medication, how your body and ovaries have been reacting to the stimulation medication. So they may increase your dosage, or they may reduce it depending on how your ovaries are growing. And again, that's a part of the probe being put into your private area, and them counting and measuring those follicles. Then you'll have another scan done just before your egg retrieval, and at that point, if everything is going, according to plan, they'll count how many follicles at the right size, how many they anticipate to retrieve. You'll then administer your final trigger injection. I would say that at that point was when I started to feel some discomfort, because essentially your ovaries are like maxed out, and you're not just growing one, you're growing however many follicles you're kind of managing or dealing with. What I would say as a bit of a caveat is let's say, for argument's sake, I don't want to go into how many eggs I've retrieved. You essentially start off with a number of follicles. That doesn't necessarily mean that's how many eggs you're going to freeze, because they may not all grow. Sometimes those follicles grow at different rates. Some may not get stimulated at all. So there's a natural attrition. So you just need to be very mindful of, yes, you're going to get this number and you're going to be very happy when you hear like, oh, I've got, let's say, 20 or 25 follicles in both ovaries, because they're on both sides. And I think usually one side has more than the other. I think that's quite normal. But essentially there'll be some natural attrition. I would say, from my personal experience, it declined about 70%. So from the number I started with to what I retrieved, and even what they retrieved, they're not all going to be mature. So that is something to be mindful about. And also, as you get older, you may not be able to retrieve. I think to even start the process itself, you need a minimum of 5 follicles. But if you do it sooner, you shouldn't really have any issues or risks in terms of not having enough follicles. So in terms of the medication itself, as I said, I was very fortunate that I didn't really feel much side effects. Just that final day of that trigger, I did kind of feel, I didn't even throw up. I just felt just some heaviness and discomfort and bloating, I would say. As part of the process as well, you will get a medication lesson with a nurse. And I'm going to put some footage of that because it was so helpful. And I would suggest that you take a camera and just record her talking, because depending on the kind of protocol they give you and the kind of medication, you may need to adjust your own dosage, or kind of prepare your own syringes, and that alone can be quite overwhelming. And you might be doing this lesson before you're actually starting your medication, so just try and prepare yourself for that. So as I said, there'll be some injections stored in the fridge, some stored at room temperature, and they'll also give you some antibiotics just after the retrieval itself. You can store your eggs for up to 10 years at a 10-year interval in the UK. And it says new legislation gives you the option to keep or dispose of your frozen eggs once you get to the 10-year point, and you can store to a maximum of 55 years. If you are married, or if you decide to freeze embryos, there's different legal paperwork you need to go down, because obviously that decision is not solely just yours. But because they were mine, just my eggs, I was able to do consent in terms of what I would want to happen to those eggs if I don't use them. So there's just things to consider there, and uncomfortable questions you might be asked surrounding death. So just be prepared for those in terms of what would happen in that instance. When you have your first consultation, the doctor will note all of your history in terms of, how regular your periods are, when your last smear test was, your weight and your height. You'll also be asked to be put on folic acid just as part of the egg freezing process, just before you have your AFC scan. So just in terms of, what you can do to optimize your health. I would suggest just keeping on top of your smear tests and any other blood tests that you might not have had. It just saves time. Any pelvic scans you might have done, just to show that you've got a normal uterus, and things like that. And all of the risks will be detailed to you. So just make sure you understand those. And if you have questions, keep asking questions, because I would leave my consultant who would talk at such a high speed, and I would just sit there like, and then afterwards I would just kind of, you know, touch base with the nurses and they would talk it through to me and I would feel calmer. So always ask questions. Um, I would say they're the key points in terms of the actual process itself and the cost. Um, you know, you don't really need to worry about constantly having to pay for anything. Once you've paid, everything is part of that whole process. And, you know, the nurses are amazing depending on which fertility clinic. I would suggest that if you are planning to freeze your eggs, that you try and go off a recommendation, because the last thing you want is to be feeling uncomfortable with where you are. And, you know, you are essentially going through a process where you will have ups and downs and, you know, feel quite emotionally overwhelmed, and, you know, you want to be surrounded by, you know, the actual best. You know, after the retrieval itself, whilst there's not a lot of downtime, I would say I just felt a little bit um dizzy, nauseous after the retrieval, but I was literally just back to normal. Um, they do give you a fit note for a week or so if you feel like you want to take that, but there's not much downtime. And as I said, the injections didn't really affect me. I did have a lot of anxiety around the injections. The injection sites are either your stomach or the top of your thighs. Now, I found the top of the thighs a lot easier. I found it easier to administer injections just by grabbing your thigh, because it needs to be at a 90-degree angle, rather than trying to grab you know, your stomach and then trying to do it at the right angle. So I just alternated between my thighs. But the nurse will go through all of this with you, and you're not alone. You're not just going to be sat there with medication and you're trying to start this heavy process and feeling like you're on your own. I would just suggest that when you do have that medication lesson with the nurse, you film her so you remember, because it's so easy to forget. And when you're just sat there with these boxes of injections, especially the one where you need to adjust the dosage, it can be quite confusing. So they'll give you the exact dosage, and there is one injection where you have to um, ensure that you're giving yourself the right dosage. And if, for example, that syringe finishes, you then need to administer the other syringe and then just do those little calculations. But it will differ depending on what protocol you're on. Um, I would say that once you've done it once, you're kind of okay with it. I was very nervous when I administered that first injection into my leg, but after that, I felt absolutely fine. Try and find somewhere where you've got a bit of, you know, meat, a bit of fat, because then it just helps with it, the uncomfortableness of it. But for me, it was, if you can just get that momentum and not feel nervous about it, once you've done it, you're fine. And that to me was my biggest like anxiety I had, was, oh my God, how am I going to inject myself twice a day? But honestly, after a while, it just becomes so routine. You try to administer those injections at the same time. So you'll have some morning ones and some evening ones. So just try and do them at the same time. I would say other things to think about is, um, you might just want to take some paracetamol if you're not feeling very well, but there's some medications that you shouldn't take. So just check again with your nurse. They should talk you through that. I think for me, it was just perhaps avoiding ibuprofen, but I could be wrong. Um, I would say they're the key points. The day of the retrieval itself, you'll meet with the anesthesiologist, you'll meet with the consultant, you'll make sure that your plan is all good in terms of, you know, any history. So I have asthma, so I was just making sure that there's not going to be any issues in terms of the anesthesia itself. But it's a very routine, if you've had surgery before, it's a very routine day. Um, you'll wake up, you won't feel anything, it'll just be the effects of the anesthesia itself. I did not feel any pain or any discomfort.